So in this video, I'm going to show you how to clean your braces and your teeth using toothbrushing aids, which is a Tepe or interdental brush, and also a floss. So toothbrushing alone isn't sufficient to clean your teeth when you have braces on. So I'm going to show you first of all how to use a floss. So first, you need to thread the floss through, either from this side or from that side. It doesn't matter. Okay? So just imagine, it's difficult with braces on because you have this wire which is in the way. So you need to thread it through every tooth. So in between every tooth you need to go through that. So which is why it is a bit of a hassle, but it is worth it because it is, it is important to keep your teeth clean. Alright, so once it's through, then you wrap the floss around your middle finger on both sides. So one on this side, one on this side. And then when you want to thread it through, remember there's a really tight point here, if you just snap it inside, you might bleed, the gums might bleed, which is what we call a floss cut. So you need to make sure you make a seesaw action. I'm going to show you. So can you see how I'm controlling with my index finger? It's wrapped around my middle finger, but I'm controlling with my index finger. So you use a seesaw motion like so. Can you see I'm pulling in, out in a control motion? So let me do it again. So in, out, in, out, in and out. Yeah. So let me show that again. Obviously, yeah. In, out with a control force. And once it's through, you do a C shape. You wrap it around the tooth like a C and clean it. And you have to go slightly deeper here because there's a little bit of pocket here where the plaque or the bacteria usually sits. So push it in a little bit. Don't be scared. And wrap it around this side, the tooth next to it, and go into the pocket a little bit. Can you see? Yeah. And that's it. And you unwrap it from your one finger and just pull it out. So that's done. So you need to do it through each and every surface. I'll show you on another surface, yeah? Sometimes it bleeds, and because if you have a lot of plaque and if you have inflamed gums, it will bleed. But after some time, the bleeding should reduce if you're doing it correctly. And if it doesn't reduce, you need to talk to your dentist or your orthodontist, okay? So again, wrap it around your middle finger, use your index finger to control, and I'll show you the seesaw action. In, out, tight point until it goes through, and then wrap it around a C on this side, C on this side, into the pockets, and you're done. Okay, so that's how you do it. Okay, now I'm going to move on to the interdental brush. So first, make sure it's the right size. You don't want anything too big because sometimes it can really blunt your gums, and you can see like a space, like you see it here. So sometimes some patients use too large a size and they do damage their gums. So you have to make sure that it's the right small size, and just thread it through in between. So some points are really tight, or at the front teeth sometimes you can't thread it through. I mean, you can't push this through, which means you need to use a floss for it. So yeah, see how you go. A floss definitely has the advantage that it cleans, wrapping around the tooth as well, where this one just like an in and out thing. So yeah, you can see, just make sure you thread it through every tooth. Push it through. And then another thing you can do is you can clean it around the metal squares. So vertically and horizontally. So you need to do it, on every tooth surface, or if it's clean, if you can see it's clean, it's fine. But if you see there's like bits of soft deposits of plaque or bacteria, then you need to clean it like so, especially at the back. And if you're not brushing well, if you brush really well, usually you don't get so much plaque deposits around here. So you just need to do a bit of tidying up with this. But yeah, it does take a while. Like when you have braces, it should take you up to like 8 to 10 minutes just to use use your toothbrush and also these toothbrushing aids. So it is normal to spend a bit more time because you do not want your teeth to have scars on them or to have decay on them, because usually you don't see the scars until you take out the brace. So yes, it is very important. So do it on all the teeth and you're done. So usually you do it after toothbrushing. And yeah, I hope you find that helpful. Thank you.